First things first, why are carrier appointments critical? Your license alone is not enough. To compliantly write business, you must be appointed with the carriers in that state. Every state you add to your license is an opportunity for growth, but you must request appointments with carriers in that state. Having the right appointments ensures you can write business legally and compliantly. You don't miss out on clients due to appointment gaps, and you are fully prepared before open enrollment hits. So carrier appointments, pretty self-explanatory, but this is how you're going to write business. This is how you're going to be competitive in the market, setting yourself up for success before open enrollment. We all know open enrollment is the biggest opportunity to maximize enrollments, clients, to capture every opportunity. Confirm you're appointed with all available carriers in your licensed state. Don't wait until a client is ready to enroll. By then, it may be too late to process an appointment. Agents with the broadest carrier coverage will serve the most clients and write the most business. I remember my first open enrollment, I didn't get all of the carriers. I just got the ones that I felt were necessary. They were the well-known carriers, but then I had a lot of clients who had, different needs and different things. And with that being said, it took me, I had to refer clients away. So if you have carriers available in your state and it's something that you know you'll write, maybe one, two, three, four enrollments out of it, I'd recommend just getting that appointment. Benavest, we will be able to help you with that if we, have the capabilities to do so. So I recommend getting the broadest carrier coverage you can. Start out with the main ones as a priority, but then go and get additional carriers. State licensing versus carrier appointments. A common misconception a lot of agents think is if I add a new state license, the carriers will automatically update, which is not necessarily true. Carriers do not update automatically. I mean, some of them do, depending on how it was arranged. I know, like United Healthcare, for example, at least they used to. They still may. That's a contracting question. Is when you get a new license that the carrier, it'll just automatically populate. But what you need to do is you must submit a request to every carrier to add the new state. Without this step, you cannot compliantly write business in that state. So for example, let's say you have 5 states, you already have Ambetter in those 5 states, and then you go and you add, let's say, Mississippi. This is a random explanation, random example. You add Mississippi, you cannot write business in Mississippi until you have requested those appointments with the carriers and got confirmation. So you got to make sure, you guys, that you add those carriers, even if you already have them in your other states. So carrier access through Benavest. Benavest gives agents access to a wide network of carriers nationwide. We work with dozens of carriers across health, life, and retirement markets. This access allows you to compete in any market you're licensed in, offer clients multiple plan options instead of being limited to one or two carriers, and build a well-rounded book of business across multiple states. So through Benavest, that's a huge opportunity for you that a lot of FMOs or a lot of other agencies will not be able to provide you. So take advantage of all of the different products that you can receive here at Benavest. Now, how the carrier selection form works, you would use this carrier selection form to confirm which carriers you need. This form ensures all of your states are covered, all of your carriers are active, and nothing slips through the cracks before open enrollment. For contracting questions, you can always reach out to office at Benavest. This screenshot here, if I open it up, it'll probably take us out of the presentation. This is all of the different carriers you can receive at Benavest. Here's a huge chunk of ACA carriers, alternative, short-term, medical, ancillary products, ton of life insurance carriers, annuity carriers, group carriers, Medicare Advantage, Medicare Sup. So point being, there are so many different opportunities and carriers that are accessible to you based on what you would like to select yourself. So I recommend getting the main group, the main line of business you're focusing on, and then from there expand. It'd be really important, if you're primarily doing ACA plans, make sure you have dental and vision in your back pocket because you'd be surprised. You'll have people ask. They'll ask every single year. So make sure you have your dental and vision set up. A caution though, that's a big list of carriers. I would not get every single one. I would go in there and I would do your homework, your research, and see what is going to be most advantage to you, the biggest offering. So, for example, maybe in the states you're in, UH1 gives the best dental plans. I wouldn't go and get 10 dental carriers. That can get confusing. I would go maybe get two or three of the most competitive in the areas you serve. That way you can just have a smooth, streamlined process. So you don't have a ton of carriers to choose from, yet you have the most competitive and the best options. So if you need contracting questions, you need more carriers, you need this sheet yourself. Like I said, this webinar will be accessible for you after. However, contracting questions, reach out to office at Benavest. They'll make sure you're taken care of. Now, getting started with our agent zone. Uh, this agent zone is a resource, your go-to resource for onboarding. So you'll have all of your contacting instructions. You'll have step-by-step guidance.